Hello there, this is Dr. Carl Hansen, Infinity Health. Today we're going to talk about psychiatric therapists and counselors. So stay tuned. Thanks for tuning in. In direct primary care practice, we do a lot of psychiatry. We have longer time with patients, and we're not going through the 15-minute patient rush type of thing. So we're fortunate. We do a lot of psychiatric treatment, which does include medicines at time, but it also includes therapy and discussing coping situations and anxiety-provoking, a lot of different things, talking about depression. So we do a lot of that kind of care, bipolar disorder. But sometimes a patient would want to go see a therapist or a counselor, or we would like to maybe think that the patient would benefit from that. So we'll refer somebody. And it's hard to determine because you don't interface with counselors or therapists that much. So how do you determine which? Well, I have a preference. And as far as counselors, I have seen that some counselors, in talking to patients of mine, that I think the therapy is actually aggravating or worsening thing. It extends the neurosis. It's almost enables the neurotic behavior or the depression. I advise patients that what you want to do is you want to find somebody who's almost a cognitive behavioral therapist, if not one full-fledged, but somebody who's going to tell a patient, look, we're going to do 15 visits, 20 visits. The first 2 visits, I'm going to kind of go over all your stuff and see kind of where you are, how you're doing. However, the remaining visits is that I'm going to work to give you tools, tips, techniques on how to improve your coping skills, how to reduce some of your neuroses about things, steps that you can take to help your depression that do not involve medications. And then the patient is followed for all these visits and held to task. The counselor will then say, well, we talked about this last week. What did you do to advance this process or advance these goals? At the end of, let's say, 20 visits, we would want the therapist or counselor to be able to discharge the patient. In other words, the patient has been equipped with the tools, tips, and techniques in order to now deal with some of the neuroses, depression, and conflicts and stresses that are going on about them. The coping mechanisms, if you will. And if after 20 visits that there's no improvement, then the therapist just says, apparently, we can't make this progress, and so, but we'll still discharge you if that's okay. I just ask patients when they're calling to set up with a therapist, when you talk to the therapist, either by phone or in person, specifically ask and demand that you would not want to simply complain or tell all your story forever and ever, indefinitely for decades, but that you want to actually learn something specific over a fixed period of time so that you can be independent of both the therapist and independent possibly of any psychiatric medications too, which is a double bonus. So that's just kind of the way I tend to steer people. Thanks for listening. If you have any questions, let me know. Otherwise, we'll talk to you later. Thank you.